to this short video about how to start recognizing quality online information according to the acronym SCALDED. The root of SCALDED was borrowed from Betty Anton, who in 2004 proposed the checklist SCALD to evaluate online medical information. I've extended it with a couple letters, and on this slide you can see the navigation and design of site purposes being those two additional things. We'll talk about those now in a little more detail. Source. There are 4 types of web address that you have to know, and I've listed them here. GOV, which stands for government, EDU, which is educational, ORG, professional or non-commercial organization, and then COM, which is commercial organization. If you know these 4 web addresses, you have some sense about the source of the information that you're looking at. Keep in mind that many hospitals have .com in their web address. Information, and especially medical information, changes really rapidly, so you got to make sure that the information that you're looking at is up to date and as current as it possibly can be. In the same way that you want to make sure information is current, you've got to make sure that it's accurate. When you look at information, look specifically for who's writing the information or interpreting it. What are their credentials, qualifications? If the information is not original, can you figure out where it came from? And is it from a primary, verifiable information source? Lastly, you've got to make sure that opinion is differentiated from fact. When you're talking about links to a site, you're really talking about judging them according to who they're associated with. Keep in mind that government sites do not require permission to link with them, and that websites should really have a policy about how they choose the links they're associated with. The design of a website is important. You need to be able to identify who the intended audience is. Also get a sense of, is the site meant to be informational, perhaps educational, marketing, or personal? Get a sense of some of the features that the website has, collaboration in the form of discussion group, chat groups. Especially make sure that there's differentiation between advertising and informational content. The ease of use of the website that you're looking at medical information on is really important. You're going to find that the organization navigation of the site is going to be the difference between pulling your hair out and understanding what you're looking at. A site that has the ability to change the size of the lettering and the language as well as multimedia is preferable. There should be some contact information on the website to report problems or give feedback about how the site's working. It's important to have a sense of the direction of the site's purpose. What I mean by this is the site set up to be educational or informational? Is it trying to maybe sell something? If it is trying to sell something, is there a clear distinction between the advertising section and the information section? If they're collecting information about you, make sure you understand why. Beware of any bias that any site may have. Consider the source of the site, and once again, knowing the website address is important in this. So that's the end of this video. This is Brissette, and I hope that what I've given you is a place to start, a checklist if you will, to start looking at medical information online. Should you have any questions about this video or the DLEI in general, please email the program